My name's Andy Mantelow, I'm 48, I live in Gravesend in Kent. I was admitted to hospital at Darren Valley and was diagnosed with pancreatic cancer and type 1 diabetes. I was in there for 2 weeks. I was released on a Friday evening and I was shown by a nurse, a male nurse on Rowan Ward in Darren Valley, how to use the needles and to inject myself with diabetes and to do testing for blood sugar levels. They only gave me 8 testing strips and about the same amount of needles to inject. Been given the wrong needles and the wrong advice. I was told to test after I'd eaten, not before. I was given the wrong needles, i.e. safety needles, not 4mm needles. And wasn't advised on what my sugar levels should be, whether they should be between 4 and 8, which I now know they should. But I was just told not to worry and inject more. I came back into the pharmacy on the Tuesday and they managed to get me more insulin because I was nearly out of that as well. And some more needles. Since then, I've been having problems with getting prescriptions for getting the right needles. And the pharmacy has just been brilliant because they've helped me out. Knowing they supplied me with more pens to inject myself with. Also, when I came to the pharmacy, my blood sugar levels were as high as 19 to 22. And I wasn't sure if I was injecting properly because I'd been given the wrong needles. I was advised that possibly I wasn't getting enough insulin into my body because I wasn't shown how to do it properly, and I was shown how to do it at this pharmacy and to check that I had to get to inject 2 mils to make sure the needle was working and to flick the end of the tube to make sure there was no air bubbles in it, and shown where to inject. I was just told to do it in my stomach, but the pharmacist advised me that I had to do it in my legs, my bum, my arm and my stomach, and to rotate it so I didn't get a build up of fatty tissue. I wouldn't know any of that when I was discharged from Darren Valley, not until I saw this pharmacist. I didn't know that the pen was going to run out because I wasn't shown how much dosage I left in. The pharmacist advised me of that. And basically I'd been injecting myself, or thinking I was injecting myself when I could have quite easily have run out. Luckily I was provided with 5 extra pens by the pharmacy to carry on with the insulin dosages first thing in the morning. So without that I wouldn't have known what my blood sugar levels were or if I was getting enough insulin in my body. I can't praise this pharmacy enough. I've failing that I might have gone into hypothermic shock or anything, but they've been so helpful with advice and trying to get this prescription right. I just can't praise them enough. They've been brilliant.